Okay, welcome back to TARTLE. We want to focus on a comment that was made by Lex Fridman, and he had a guest on, David Sinclair. And David Sinclair is the foremost thinker on longevity research.
He's a biologist, I think.
Living longer.
Scientist.
But he deals with bioinformatics. So really data within biology itself. And they were talking about a point of having issue collecting actual data on human beings. So I want to listen to that, and then you and I want to dialogue about it.
Yeah,
so
we'll just pause it when you come to a point, and because this is probably like a 5-minute thing, so we'll just pause it and go through it.
Yeah.
I think it'll be awesome.
Bioinformaticians. A lot of our work is now just number crunching. A part of that is collecting the data, which is kind of something we've talked a little bit about, but is there something you can say about how we can collect more and more data? Not just on the one person level, like for you to understand your like various markers, but to create huge data sets to understand how we can detect certain pathogens, detect certain properties, characteristics of whether it's aging or all the other ways that the human body can fail. It seems like with biology, there's a kind of privacy concerns that, well, actually not privacy concerns, it's almost like regulation that kind of prevents like hospitals from sharing data.
Okay. So let's just...
Because there's two things there.
Yeah.
He got into privacy, but before that, he was talking about basically data packets.
It's data packets, right? So when you go on TARTLE, we have social determinants of health.
Mm-hmm.
We have geolocation data. We have genetic markers from 23andMe, okay? We have your electronic health record. The amount of information in those 4 data packets alone is more than enough than any researcher could ever need on just one specific individual.
But they have to realize these people are giving this data up. And he's going to talk about this later.
Yeah.
These people are giving this data up willingly, and they're getting paid for that
And they're
data.
getting paid to do it.
We're not taking it from
So
them.
if you want to purchase supermassive data sets from TARTLE users across 222 countries, and you want to capture this information to help your bioinformatics or even help your longevity studies, you do that with the TARTLE marketplace. All right. And so now he's going to talk about privacy here for a second. You have this idea of HIPAA. HIPAA is talking about protecting sensitive medical information because somebody else is holding it for you on your behalf. They actually don't have rights over your information. That's your medical information. So the only way to unlock this sort of barrier, this amount of friction for moving data back and forth, medical data, is to have an individual consentfully share that information to these bioinformatic researchers, or this gentleman here, David Sinclair, and his research would be like, okay, David Sinclair goes to TARTLE, and he's like, I want these people, this age, this sex, this country, okay? And I want to buy data packets A, B, C, D, and E regarding their health information. Go do that. You've now generated your super massive data set. You've collected it instantaneously with absolutely no barrier to entry for it. No friction.
The beautiful part is, with this privacy concern that he's talking about, why are you able to purchase the data ethically?
You're able to purchase it ethically because the person that owns that data, the individual, has consentfully chosen in this transaction to give you this asset, and it is now in your ownership. Hospitals can't do that. Hospitals can't give it to pharmaceutical companies. They can't do it to all this other stuff. They lose all these specific markers, identifiable information, because they don't have rights to it. TARTLE fixes that whole thing because you put the power in the hands of the individual, and they are the ones that share it. So this issue that they're speaking about actually is no longer an issue.
Well, listen.
They just haven't heard about us.
Yeah, let's watch this. This is interesting.
You know, I'm not sure exactly how to say it, but it seems like when you look at autonomous vehicles, people are much more willing to share data. When you look at human biology system, people are much less willing to share data.
Okay. So regarding that, people not being willing to share it, first of all, they didn't know they could share it. That doesn't work in the context of everybody. Your autonomous vehicle, you bought it because you understand data. You understand what autonomous vehicle means. That's also a certain socioeconomic profile of individual that can afford an autonomous vehicle, correct?
Right.
So they're going to be able to understand, data sharing, how does that work? The thing is, there was no tool available that helped people understand the value of sharing data. They didn't share biological data, one, because Pharmaceutical companies and hospitals want to hold a death grip on it because that's where they're getting their resource pump from. They're raking it from human beings. They're not sharing that value with you. That's why no one sees it, because of the perverse incentives for them not to give you access to it. TARTLE fixes that balance, that power asymmetry. Now, people can understand the value of sharing data. So biological information that Lex Fridman is saying that people aren't willing to do it, well, that's a certain socio-demographic people, and they don't understand it. TARTLE educates you on the power of sharing it, financially incentivizes you to do so, and it opens up those floodgates, allowing those supermassive data sets to come through so that David Sinclair and his company and anybody else that wants to do any sort of type of research around medical, or I don't care what it is, can now get that information consentfully, ethically, and source it directly from that primary thing. And it's identifiable. Doesn't that sound fantastic?
Yeah, let's see. This is interesting. Watch this. He's going to get heavy into it.
A hopeful path forward where we can share more and more data at a large scale that ultimately ends up helping us understand the human body and then treat problems with the human body.
So sharing it at a large scale. TARTLE,
200. Dude, we're not going to get through this video.
No, I know.
Every 3 seconds,
like
we're going to have to have part 3, 4, 5.
I feel like you and I listen to this stuff all the time. Like people are saying that's like, guys, it's already there.
I yell at the screen all the time. I was watching this, and so I sent it to you. I literally yell at the screen and say, "We have the answer."
Yeah, like Lex Fridman and David Sinclair, we're tagging you in this. Like deal with it. I mean, like this is just what's going on. Like your option is here. Your solve is here. If you want to juice your genetic engineering, you're going to do it through TARTLE. If you want to juice your understanding of human beings, you do it through TARTLE. You just haven't heard of us. And now you have. This is the answer. It's been sitting here in front of you. You just didn't look for it.
Go on, because he's going to talk about like his own personal health data.
Yeah, let's go for it.
This is cool.
So we are right in the middle. We're living through what's going to be seen as one of the biggest revolutions in human health through the gathering of data about our bodies.
Okay. Okay, I'm sorry. I'm sorry. That revolution, driven by TARTLE. Actually, no. That revolution is driven by human beings using TARTLE.
Yes.
Is that fair? It's going to be human action and human responsibility over our information and our choice to share it truthfully with those who really want to help us with that information. That's how that revolution happens. And you can do it today. You can sign up for free. Right now on TARTLE, populate data packets, share with people like this. You want to live longer? This is the research you want? Go ahead. Start sharing it, and they'll pay you for it. You kidding?
No, I love it.
Should I keep going?
Yeah, let's go. I'm into this.
And 20 years ago, people didn't want to go on social media. They're worried about it. Now you have to if you're a kid, that's for sure. Same with medical records. These are becoming all digitized and expanded. Ultimately, we're going to, even if we don't want to, have to be monitored. There's going to be a court case that I bet 2-3 years from now someone's going to say, how come my father died from a heart attack? You had these biosensors, $20, and you didn't use it. Lawsuit right there, and suddenly all hospitals have to give you one of these. There'll be a reversal, like to where it's your fault if you don't collect the data. That's brilliant. That's
Okay, so this data collection decreases liability. This is what we're talking about with TARTLE. They're talking about a fundamental of the guy already dying. I want to prevent the death. TARTLE can help in that prevention through understanding of what keeps people healthy and what drives them to become sick.
Well, it's also in the context of what he's talking about. David Sinclair is wearing a heart monitor it's like a sticker thing.
Yeah.
It's a new piece of device. So it's constantly every milliseconds monitoring his heart. So it knows, and he talks about this, if he's having sex, they were making jokes about that, then it's going to monitor his heart rate and be like, and then working out or sleeping or whatever.
Right.
So this data can predict patterns that will say, hey, well, probably in the next week, you're going to have a heart attack.
Yeah.
So you need to go to the doctor now. So, but liability with these hospitals is very, very important.
Yeah, because
that's what he's talking about.
You can be proactive once you get the data and understanding. And instead of waiting, like he says, for 2 to 3 years for a court case, I have no interest in court cases. We can solve this right now. We can better human life right now. Lex Fridman, David Sinclair, all these other pharmaceutical companies need to become more aware of the availability of this information and its access. And that happens directly through the TARTLE marketplace, and it brings you right to those people generating that health information.
Okay, this is so much fun. I love this. This is great, bro.
Absolutely right. I mean, that's absolutely right. That's the frustration I feel on going to the doctor. Is like, it's almost negligent to not collect the data, because you're making, if there's something really wrong with me, and you're making decisions based on very few tests, that's almost negligent when you have the opportunity to collect a huge amount more data.
Okay. Sorry. This is too much. This is rich. We have the ability to collect data, which we do. We have the ability to share it, which we don't do enough of. The tools and the options are there. Negligence is because you're ignoring the facts. You're ignoring the tools. There is negligence because these other companies are trying to pull all the value for it for themselves. And because they create that roadblock, it hinders human evolution. It hinders our advancement in health. It hinders our advance in bioinformatics, pharmaceuticals, and longevity research for human life. Because someone doesn't want to look at the full picture, and the people that do have their data don't want to share it unless they get a massive chunk of change to do so. And the stuff they do share lacks any sort of real value because it doesn't have the markers in it, because they can't bring it all together.
That's so crazy. Yeah, I mean, he's gonna get into this. I think this is really good. Let's go on.
Go back to this.
Yeah. No, I think this is fun. I love it.
Well, let me tell you something. Yeah, like I've got this inside tracker data for myself over a decade, and you'd think my doctor would roll his eyes at this. Oh, he's gone to a consumer company, blah blah blah. I had my first checkup in a year with him through video conference, and he was running blind. He really didn't know what was going on with me. He asked the usual things: how am I sleeping? How am I eating? These kind of usual things. And I said, well, I've got new tests back from Inside Tracker. And he said, great, I'd love to see them. So I share screen and we look at the graphs, look at the data, and he's loving it because he cannot order these tests willy-nilly. So I said, well, let's order a HbA1c, blood glucose levels, because I'm very interested in that. That tracks with longevity. And he said, well, I have no reason to order that. Do you have a family history?
Okay. The reason he has no interest to order it is because insurance is preventing him from doing that because it's so fucking costly.
Well,
because it's a scam
I have a story to this
of a system.
Yeah, well, so it's all insurance. It's all insurance based. So, getting my testosterone tested. You know, as you get older, testosterone's a hormone. There's testosterone therapy that you can do, and you can put your levels back to when you're a 20-year-old. Pretty safe because you're just taking a hormone. It's not a drug; it's a hormone. So people have to understand that. But this is really interesting. I was talking to a doctor. So now most people that do testosterone replacement therapy have to do it outside of insurance because insurance won't pay for it. It used to be, because healthy levels of testosterone, you know, are like 400 to 1200. So what they did was, because too many people were coming in with low testosterone and then getting testosterone therapy, so they lowered it down to, I think it was Blue Cross or one of them, lowered it down to 250, which is like horrific. If you're at 250 testosterone level, because they've already have studies that if you have low T, then you're going to have other problems. You know,
they're only incentivized to save their money. They don't want to pay out.
No.
So they make it impossible for preventative care.
What did he say? His doctor said, I have no reason to order this test.
Because the doctor's only concerned about money, not about his health. Listen, if you make it so difficult for people to achieve these specific benchmarks, no one will follow through with them. Insurance will only deal with you when you're sick. They have no interest in paying out when you're healthy. Their whole idea about health was like, oh, we'll reimburse you for a gym membership. Are you kidding? You should pay for every test under the sun that allows me to figure out if I'm on the track to becoming diseased. But guess what?
It should be all preventive care, but it's not.
They don't want to.
No, it's called sick care, not
one
health
of your
care.
Correct. One of your number one places for preventative care is the TARTLE marketplace. That's where we do this. And it's not going to happen with these bureaucratic hospital institutions.
No, you can't rely on them.
That
you can't rely on a politician.
That are in this like sick, twisted bed of like insurance scamming that they're using, right? Because they've inflated prices so much and they don't want to do anything preventative. You're all worried about just what the billing code is and getting people out the door. That will never work. It will occur in the private market with outside researchers creating privately designed devices, and we are going to engineer ourselves outside of hospitals to keep ourselves healthy.
But the problem is like with educational access, it's the same thing with health access, in the sense of people that have funds can afford to pay externally.
Yes.
And this is the issue that we're facing. But he's going to talk about data more, but this is really interesting what Lex
So why
says.
is it that people that tend to have more money, right, or sit in a higher socioeconomic profile live longer? They have access to more health resources for preventative care.
They're paying it through the private.
But for the other individuals that don't have access to good food, that don't have access to good resources, that don't have access to good hospitals and doctors, they're stuck waiting until they're sick at the very last moment to go into an emergency room.
Yeah.
And then the state pays for it after they're beat up and hurting and needing, but not preventing it up to the point of actually bringing them in there. You got to keep them healthy. And the only way we can understand it and be proactive is to get the data now. Don't get it after the fact. Hospitals are a reactive system. We need to be proactive with it. These researchers like David Sinclair, who are on those front lines, want to get that proactive information. But doctors with their mentality are stuck. The vast majority of them not looking at all the data, not sharing information properly, lacking access, and have no interest in the proactive approach because it's not of an economic benefit. Why is it that I want to go to an acupuncturist? They're like, I only need you here 3 or 4 times and you don't have to come back. They're not in the business of making money off of you. They're in the business of making you healthy. Doctors should be in the business of losing money, not making money. Does that make sense?
Yeah, they should be not for profits, the insurance companies and stuff.
Gosh,
we won't go into that,
kills
but
me.
yeah, listen, this is really interesting.
No. Do you have any symptoms of diabetes? No. Well, I can't order the test. I almost wanted to reach through the computer and strangle him.
Okay. I'm vibing with him right now. He's 100% right. I'm sorry I'm stopping this, but that right there, that moment is like, I am trying to keep myself healthy, but you're telling me you can only help me when I'm sick? Why is it when people have to move to the most vulnerable state is when the other part of the resource holding majority wants to come in and say, okay, here's a little bit of help? What's with that mentality? How can we have real public health in our big 7 if we're so reactive? We're only focused on sick care. That will not help us going
It's all
forward.
lagging indicators too. It's like, well, what's up with your dad and mom? Oh, so you have a history of diabetes? Oh, okay, then we can. It's like, yeah, it says, yeah, but we'll go back to this.
But instead, I pay a little bit to get these tests done, and then he looks at them. So that's now the way consumer health is going, is that you can get better data than your doctor can, but they like you to do that.
They want you to do it because they want you to eat the cost.
You would be a bad Siskel and Ebert. Bro, we literally can't do. We're not even halfway done through this.
Because, dude,
this is a 3-minute section.
I know, but every statement is packed with so much stuff. It's hard for me. And it's hard because the obvious
We're
answer...
not stopping till this is done.
The obvious
I'm not doing part 2. We're going.
Bro, the obvious...
This takes 2 hours. We're going to have a 2-hour podcast. I'm on this, bro. We're going.
The obvious answer has been here the whole time.
I knew this was going to happen. I was like, I'm going to get him so fired up.
I'm so jacked up right now. It's pathetic.
And it's not the coffee ice cubes.
No, it has nothing to do with my Mizadashi. Okay? Here we go. Let's keep
So
going.
no. What was he saying? Because you didn't address it. Because I interrupted you.
Oh, where the consumer stuff is going.
Yes, the private. He's having to get. He said, I have better data than my doctor does.
And they want you to do it because the doctor is not incentivized to pay to keep you proactively healthy. That is what it is. It is all this sick, perverse system of economic-driven healthcare. You care about the money before the human. The money is driving your decisions, not keeping the human healthy.
Of course, it's a corporation.
What kind of a fucking oath?
They have to make from the CEO down. They have to make profits every quarter.
What oath did you take as a doctor? Do you remember that? Do I have to hold that up in the screen? Walk into a doctor's office?
But it's not the doctor. It's the corporations that are running this.
I'm not blaming the corporation at all. The doctor, at the end of the day, has the final say. And if he is not making the decision to do these things proactively, That's because his incentives do not lie for the human being, but lie somewhere else.
That's why we had Casey on, and we just released that. We did 2 or 3 episodes with her where she had to get out of the system.
Yeah.
She's like, the system's so corrupt that I had to get out. And she started the direct primary care clinic where she's in charge and she can sit down with people for 45 minutes an hour and go over and order their blood tests and go over all these tests and see what people need to do. It's very, very simple. Let's continue. This is great, bro. It's going to get hot. We haven't even got hot yet. Watch.
Quick human question. Maybe you can educate me. I think
Alex
doctors
will.
sometimes have a bit of an ego. I understand that the doctor is super experienced with a lot of things, but this is a fundamental question of human variability. Like, I know.
Okay. I'm sorry. Before he gets into his question, human variability, you and I did an episode on the 2x2 quadrant.
Right.
That's a 2-dimensional world. Doctors and insurance companies want to keep you in those 2 dimensions for their economic incentives. But you, as an individual, are extremely unique. Everything about you is so unique. No other person on this planet is like you. That uniqueness is the fundamental thing that is missed within our healthcare. We want to statistically flatten human beings and put them into buckets and say that we fall into this deviation or we're most likely to do this. Why? Because other people did it? Well, guess what? 99% of the shit I do personally is nothing like anyone else does.
Yes.
So how could you say that my health follows suit in the same way how other people are acting? It doesn't. It doesn't at all.
The only way you can do it is by collecting mass amounts of data on the person and then allowing that data to speak for itself in a non-biased way.
You're so good.
Okay, let's go. This is great, bro. Wait, it's going to get better.
A lot of specific details about, like, depends, of course, what we're talking about, but I bring a lot of knowledge, and if I have data with me, then I have several orders of magnitude more knowledge. And I think there's an aspect to it where the doctor has to put their expert hat, like, take it off and actually be a curious, open-minded person and study and look at that data. Do you think it's possible to sort of change the culture of the medical system to where the doctors are almost, as you said, are excited to see the data?
Before we get into David Sinclair's answer, doctors, if you go into a hospital right now, what's the average amount of time you get to see with a doctor?
Yeah, by the time they move you around to different rooms and all that stuff, 5 minutes, 3 minutes?
Under 2 minutes.
Yeah.
That's your interaction with the doctor. Do you think they're all going to take the time?
They don't have time. They can't do that.
Why? Because insurance says move through the people like cattle. The hospital operations, the CEO, the board, move through the people like cattle. We need to make money. We got to build this stuff.
Yeah, they have no time to look at your reports and go over.
The culture won't change unless the incentives of how hospitals and healthcare works fundamentally changes at its core. You can't look at human beings in a dollar value format. You need to look at them in absolute uniqueness as a human being.
Well, it's basically you're going to have to take the responsibility amongst yourself to handle.
Correct.
To be proactive.
So this is what's going to happen. Like Casey, she runs her private little healthcare institution outside of hospitals and all that other, very political stuff. We will end up collecting all this data, IoT devices, uploading it into TARTLE, EHR uploaded into TARTLE, genetic stuff uploaded into TARTLE, my 23andMe, which is also private, okay? My behaviors, food survey studies, all this stuff will go into here. And then an individual will show up, some sort of company, and say, I will analyze your TARTLE data packet and give you some advice on it. Actually, I won't even give you advice. I will just say that across the board, this is what we are seeing with all of this stuff. This is our understanding of you and your uniqueness. And the best action you should continue to take based on your uniqueness is this. And no hospital will do that. They can't afford you the time. But cloud computing and all those other things, when someone puts those algorithms in place to help with unique analysis of individuals, that will change this. It's not going to happen in hospitals. You can't look to hospitals, which are entrenched in old, archaic systems, to be forward-looking and advanced and think that they will change their financial, economic models and move over to a human-centric model. It's not going to happen. The human-centric model will change with other healthcare individuals in the private sector that realize what can be done with all of this data to actually keep people healthy and understand that analysis.
Well, I mean, I think you're going to see this direct primary care model for, it is going to be proactive in the sense of, why could you not do that online with Zoom calls? So why could you not have a nurse practitioner or a physician assistant order all the tests? You go to your local lab, you take all these tons of tests that the doctor can't order, but you can go, and it's very inexpensive actually to do the test if you don't go through insurance, which is funny. And then now you schedule online through Zoom a 45-minute hour conversation to go over all your tests with you. And then you pay a monthly fee. That's going to happen.
It's going to happen.
It already is happening. Like, you can do, they're specializing that way, but you can do hormone.
Yeah, but in mass, it's going to be more beneficial.
And everybody would sign up for that. Like,
yes.
Why not? We just created a business right here off of
it just happened right here. Thanks, Lex Fridman.
Thanks, Casey and Lex Fridman.
Yeah, I really appreciate it.
We're almost done. Look, this little red line is at the end.
I'm giving this 2 more minutes.
Okay, you can't talk then.
Or that's already happening. It's really happening. Now, we've probably lost the last generation. They're no hopers. But so I teach at Harvard Medical School, and they're excited about this. They're excited about aging, which is a new aspect to medicine. Oh, wow, we can do something about that. And then, all this data, what do we do with it? There's still the traditional pathology and all that stuff, which they need to know. But time will change their mindset. I'm not worried about that. And like we were discussing, this isn't a question of if, it's just a matter of when. And it's, I have a front row seat on all of this. I had breakfast with a CEO who is making this happen just yesterday. I can tell you for sure that most people have no idea that this revolution is occurring and is happening so quickly. If you're running a hospital and you can save $2,000 per cardiac patient, what are you going to do? You have to use it. Otherwise, the hospital down the road is going to be beating you. And there are large hospital aggregations, so there's Ascension and others that just have to go this way for budgetary reasons. And right now, the US spends, 17% of their GDP on healthcare. For, let's say, one of these buttons on my chest costs $20, it's rechargeable, and it can predict people's health and save on antibiotics, prevent heart attacks. How many billions, if not trillions of dollars, will that save over the next decade?
Yeah, so when the public wakes up to this, they'll almost demand it. Like, this should be accepted everywhere. This is obvious.
If it's accepted everywhere and it's obvious, we've had 222 countries wake up to it. The United States needs to wake up in the healthcare format and take control of their health. You can't be reliant on people that are not taking care of the health for you. Those individuals are only interested in getting a piece of the pie of the 17% of the GDP. That's all it is. The metric should be, how long have we kept people alive? How long have we kept them disease-free? How have we helped them understand themselves in their own individual realms of reality?
Yeah, so he's going to get into the most important part about data
right
now.
And that's it. And I'm shutting this off.
No, we haven't got to the good parts yet.
It's going to save a lot of money. It's going to improve the quality of life.
Well, and the CFOs of hospital groups will have to. And insurance companies are going to want to get in on this. So now that gets to privacy, right? Should an insurance company have access to your data? I would say no, but you could voluntarily show them some of it if they give you a discount.
No way.
Now we're going to get it. This whole rest of this part is all TARTLE.
Oh, dynamic data pricing on your insurance because you've given them more information. So the more you choose to give with them and share, the better price you get because they can underwrite better. Dude, we've been talking about this for years. Harvard's just waking up to it. Happened right here because people on TARTLE, human beings, are taking responsibility for their data because they know the greater benefit that can happen for themselves and the rest of the globe. And we will finish this on part 2.
Oh my God, I told you I didn't want to do a part 2.
We're doing part 2.
Why can't we just do an hour of this?
No.